Well, welcome back to Better Living. I'm here with Sam from PT Link. We're talking about cupping. We talked about this with you guys last time y'all were on. Kind of got trendy, or people learned about it. It wasn't that it got trendy, but people learned about it during the Olympics, thanks to Michael Phelps and his circles all over him.
Exactly.
You know, people are like, what is wrong? What is wrong with him? What is that? And we learned about cupping them. For somebody who didn't hear about it, then explain to them what cupping is.
Right. So basically, cupping is actually a simple procedure. We're taking plastic cups and creating a vacuum within them and pulling the tissue away from the body. If you think about it, most of our treatments that we do in physical therapy or in other professions are more compressive in nature. So if you think of like massage or joint mobilizations, whereas cupping is more decompressive in nature, and it's pulling the tissue and skin away from the body.
And we've got some videos so people can see kind of how it works and what the process looks like. So as we're looking at this video and seeing how the process works, tell me what this does. What does pulling the tissue away from the body, what does it do for us?
Right, so if you're looking at this video specifically, we're trying to increase range of motion. So this gentleman, he has some tight tissue, so his fascia may be tight, the muscles may be tight in that area, and we're specifically looking at anatomy, and we're placing those cups in specific places based off of some deficits that we find when we evaluate him.
So what the benefit, in his case, is a range of motion. What are some of the other benefits of cupping?
Well, if you're having pain, we work with a lot of patients with neck and back pain. And if you're having pain, we can put these in specific spots that will alleviate some of the tension around those areas, around the painful areas. And we get some really, really good results for that.
You mentioned neck and back, and we see kind of on his shoulder area. Where are some, are those the main areas that you can do cupping on?
Well, and that's the good thing. You know, our knowledge as physical therapists, we really focus on anatomy of the body, and we understand some of the physiological changes that happen when we're doing some of these procedures. But we can really try to, like, if you look at this picture here, this is a little different, so we're moving the cup this time too. And really what I'd like to point out here is, if, like, a lot of the things that you would see on during the Olympics, that was more of a traditional cupping, the things that they were showing you. But what they were actually doing with the athletes were closer to this. We've actually adapted some of those systems and incorporated them with our treatments. And if you look here, we're doing a lot of movements. We're moving the cups, we're having the patients move, we move you or stretch you. So it's not just a real static move. It's not really a static treatment. We're actually trying to activate certain muscles and with some of these different things, and also target certain tissues.
Well, and obviously, in the case of the Olympics, they are doing it for a performance component. That's what they need it for, so that they can perform better, as much as we would like to think. So we are not all high-performance athletes, and we're not competing in the Olympics or even in pickup basketball games for the most part. We would use cupping for just everyday activities, so that we can be pain-free, or so that we can just, pick up groceries, those kind of things.
And when we're really focusing on this, our main goal is to improve the way you move, improve the way you sit. Posture is very important.
As I set up.
Yes, posture is very important. And say you're going to pick up something. If you have a restriction that's forcing you to move improperly, we need to correct that, because then you're going to do it wrong, and then you could potentially injure yourself.
And you're going to hurt something else. If you're trying to protect something that hurts, then you end up injuring something else. So who can benefit from cupping?
Well, like I said, neck pain, back pain. Really, if you're in any type of pain, you can come in, be evaluated, and see if this is appropriate for you. Primarily those are the areas where we're really working with people. But also shoulders, knees.
But so it could be anybody, from somebody who perhaps is a younger, a 20-something who has an injury, to someone who's more seasoned like me, to someone who is even more seasoned, who is perhaps an elderly.
Geriatric population. And we've used it across the board, and we're really getting some very good results, along with dry needling, which I know you talked with Mike a few weeks ago. And we actually use them in combination as well. And we've been just getting really good feedback from patients, from the physicians that send us patients. We've been seeing some really, really good results.
So what do I need to do? Is it covered by insurance?
It is. It is.
Excellent.
Yes, absolutely. And that's primarily the main patient population that we see is an insurance population. We do have a private pay system if you'd like to do it that way. And you can come and see us without a referral.
That was my next question.
Right.
Do I have to have a referral from my doctor?
No, not at all. In Ohio, we have direct access, which allows us to evaluate and treat patients without a script. But we also have a lot of physicians sending us patients, and we see those patients as well.
You guys have several locations around.
Yes, yes, all over the place, all over the area.
And so we just need to go to your website. We can find those. The most important question for me, is it going to hurt when I'm having it done?
No, it's not. Actually, a lot of our patients find it pleasant. I've had many patients tell us it kind of feels good. I've had it done. I think it feels good. It's a different sensation. So it's something that you have to kind of get used to at first, but it's just different than what you're typically feeling like with a massage or a different treatment like that.
Well, this is a perfect alternative to pain medicine, which is always good. Treat the symptom instead of just masking the pain.
Correct.
Give PT Link a call today. Check out their website. We'll be right back.